To document on our past medical and family history, we're going to come to this section and click on Assessed and Updated. It's going to open up our past medical history window. We're going to go straight to our problems list. We're just getting a patient's history, so we don't want to add diagnosis, we just want to add problems. So I'm going to click on Add. It's going to open up my search window. I'm going to type in shortness of breath, and it's going to bring up all of my options. So I'm going to click on the first option and then OK. On my classification, I want to make sure this always says patient stated. Hopefully it defaults to that automatically, but if it doesn't, make sure you go in and change that, because again, we're just getting a history. If you have any extra information, go ahead and provide that here. And now I'm going to click on OK and Add New. So now I'm going to add COPD. Okay, so I'm going to choose the first one. Click OK. Again, make sure your classification is patient stated. If you have any additional information, go ahead and fill that out. Then click OK. So notice how it moved all of my problems into my problems field. So now I'm going to come down here and document my family history. So I'm going to click on Add. It's going to open up our family history window. The quick list is just some quick options that I can set per user. So if I find that I'm choosing certain diagnoses or family histories, I can add those to my quick list. To do that, you just click on this magnifying glass and you select whatever you want to add to your quick. I can just double click, and then say OK, and notice it adds it to my quick list here. If you need to add a family member, so someone other than mother, father, sister, and brother, you just come up here to this icon and click on Add Family Member, and you can choose from the options that are listed. Okay, so I'm just going to go through my history. So I'm going to scroll down and I'm going to document any of my family history. So here I'm going to say the mother has asthma. Notice it tells you you can double click for details. So simply double click and it'll open up a window for you to fill in extra information if needed. Okay, so you just go through here and get a good history. Again, you just click in the column. You can double click to add more information. If there is a group that needs to be added, you can click on the Add Group icon. So if you need to add a history in the ear, nose, mouth, and throat, immunological, okay, musculoskeletal, so I can click on that, and it's going to add that group to my list, so I can now select my family history. Once you've obtained your entire history, you're going to click on OK. So notice now I can clearly see the history for my patient. So now I'm going to close this window out. To document your illnesses and surgeries, you would come to this section of the Admit Patient History form and click on Assessed and Updated. You would document your previous illnesses and hospitalizations as we do today, but what has changed is this surgery, procedure history. It's now a control. So you would come down here and click on Add. You would search for the procedure. So I'm going to search for thoracostomy, or what we know as a chest tube insertion. And I'm going to pick the appropriate procedure. Okay, notice how it fills the procedure in. Now I want to fill out as much information as I can. So I want to go ahead and enter a provider and the date this procedure was performed. The more information, the better. Location, the only option is UMC as a location. You can't actually find each individual unit. And then you can say OK. And notice how it adds that surgery or procedure history to my patient. If at any time during the patient's stay a procedure is performed, you need to make sure you go ahead and enter that information. To do that, you would open your patient's chart. You would come to the Histories control and make sure that procedure is selected. Then you would click on the Add button to add a procedure. So here we're going to search for PIC because they did a PIC placement. Okay, so again, you want to look at all of the options and make sure you're choosing the appropriate one. And you also want to provide as much information as possible as to the person who performed the procedure, the date the procedure was performed, and then click on OK. And then notice how it added the PIC insertion to my patient's procedure list.